usually I ask the patient to stand, look at from front, from side, and from back, right, and to see if there's any problem. So, common things, important things that you inspect in such a relieve every complaint of hip or groin pain, including, first of all, if there's any muscle wasting. The first greatest muscle to be wasted is, apart from the thigh muscle, is the gluteus muscle.
Gluteus.
Gluteus maximus. Okay. So this usually, so if you really want to know, then you need to pay attention to that. And then sometimes you need to see if in cases there's a in cases there is any long-term hip problem, sometimes the patient may develop, for example, some hip flexion contracture. So because of chronic pain, then he or she may stand with a like this, because pelvis is not balanced and it tilts the pelvis, etc. And there may be secondary scoliosis, so you look at the spine to see if the trunk is bending. Okay? And then so this is just inspection. The most important is still palpation, and that's usually tell you where is the painful area. Okay? So starting usually I start from palpating because it is painful, right? This one. So I start palpating the anterior superior iliac spine here, which if there's any problem, then which signifies the sartorius muscle injury, especially for young adolescents. If there's any avulsion from sartorius muscle, then there will be tenderness around here. And then palpating lower down along the iliac crest here is the anterior inferior iliac spine, and which is the attachment of the rectus femoris. Okay. And then further palpating down, essentially when you feel the femoral pulse, boom, 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 the femoral artery. Essentially that is the hip joint, the center of the hip joint. So if there is any intra-articular hip problem, that may have pain. Then you can go further palpate to the midline until you feel here. This is the pubic symphysis, the midline. So if there's any pain, there is problem over there. Like, for example, sports hernia or rectus lower part of the rectus abdominis muscle strain, then you may have problem over there. Okay. The other transport that you want to palpate, usually I would like to is try to ask the patients to flex the hip a little bit and then rotating out a little bit. And in this position, you can palpate a lot of things. First of all, you want to palpate the bone. You want to palpate the bone over here, which is the bone where you sit, is the ischial tuberosity. So this is the hamstring insertion, okay? Then you can palpate high up is the insertion of the adductors, okay, until you reach the pubic symphysis, okay? Now, you can put a finger around here, okay? Now you can palpate, use a big muscle belly, and then till here is a tendon, a rock-like structures. This is the adductors. This is the best way to test the adductors, because if you do this, you're not tensing up, sometimes it's difficult. But when you do this, he may already tell you that there's pain. It's okay, right? Now it's okay. Can you try to close the up? Is it painful? A little bit. Still have a little bit pain after 2 weeks. So after 2 weeks, injury, well, a little bit pain, no bruises. Well, probably it's a grade 1, or most grade 1 to 2 injury of the equipment. And usually it's taken about 2 to 4 weeks time. So it's now probably about 70%. He's started to resume a little bit training, but you need to be careful. So this is the way to test the equipment. And in this position, you can then bend up the thigh and then straighten up the knee to see if there's any pain and tenderness and tense feeling along the hamstring. So this is the medial hamstring. You can palpate from the distal along, possible going back to the ischial tuberosity. Okay? So this is the hamstring. So this is the common injuries for the groin. Then you can ask the patient to turn around over there. Okay? Turn around over there, and then you are now exposing the outer part, the lateral part, and the posterior part of the hip joint. So at the lateral part, what you need to palpate is here. Yeah. This is the pituitary center. If there's any case of jointural bursitis, then you may have pain. Okay. So, and we'll this is with another case on the rugby players later on about how to examine this in details. But this is one of the ways that you can palpate the bridge center to see if there's jointural bursitis. And then you can give us a chance to palpate along the iliacal band to see if it is very tight. Another way to test it is the over test that I mentioned. Right? You can try to do this. and then slightly relax, you can drop. So this is normal. But in case of people with very tight iliotubal band, you do this, and then you take away the hand, you will still be remaining there. It's very tense, or you need to lift up the trunk so as to allow the knee to drop down. Then this is a very tight iliotuber. We may see a case. Okay? So this is the very simplest way for you to test common sports injuries problems. Finally, I just want to demonstrate a few special tests to look for intra-articular problems. Because all those I mentioned is muscle problems, joint bursitis, tendon problems. Okay? Final way is to test the intra-articular problem is like for example, labral tear or hip impingement. So do you remember the Faber and the Fader test? F-A-B-E-R. Okay. So first of all, Faber is like this. So flexion, abduction, and external rotation. So this is Faber test. Okay. To see if there is any impingement at the anterolateral aspect of the joint. So someone would like to do this. Put the hand here, put the leg here, right? And see if he can really push the knee, try to as close to the back as possible, and then compare with both sides. If you cannot really external rotate your hip, you may end up in like this. You cannot really going down. You go further, it's very painful inside the joint. Usually the muscle tendon will not have any problem when you do this. Okay? So those things extra-articular will not have pain on this. Only things is intra-articular that you may have pain on this. This phase. Fader is flexion, adduction, and internal rotation. Flexion, adduction, and internal rotation. So this is testing the impingement over the inner side of the hip joint anterior. Okay? And you can also do the test that you very much like a memory test of a hip joint to grind the hip like this. You grind the hip to see if any loose labrum, loose body inside the hip joint. Simplest way, similarly, you can do the lock rolling test by doing this. So all those intra-articular hip problems will be presented with pain when you do all this. Okay? So thank you.